I just would love to say hi to people who are watching me. And of course, it's important to say and recognize your participation in this session. Right. I have few people saying hi. And of course, and Jacob says hello and thank you so much. Josna says good evening, sir. Good evening. So Ambika says good evening, sir. Good evening. Right. Roshni Vinod says good evening. Paulson David says good evening, sir. So Paulson, good evening. It's a lot of people, and that's the beauty of Medcity's live session, because we get a lot of people from different parts of the world. Hena Sharma says good evening, sir. Good evening. Right. All right. Rachel says good evening, sir. Good evening. And the last session, during the live session, we discussed reading part B and C. Today, exclusively, we are going to look into part A, which is comparatively pretty easy. Unlike part B and C, of course, part A is pretty easy. Of course, meanwhile, there are a lot of people joining me. Alina says hello, hello. Bharati says good evening, sir. Naina Raj says good evening. All right. Ashna Joseph says good evening, sir. We are waiting for this session. Oh, thank you. Thank you so much. This kind of words are always encouraging and which really help us to come up with more sessions. I hope this would be fruitful for such people, those who are eagerly waiting. Shamlal says good evening, sir. Good evening. And Amrita Uday says good evening, sir. Manju Thomas says hi, sir. Good evening. Right. There are a lot of people joining me, and I really want to say hi to everyone. But if I keep on saying hi to, I would rather say the purpose of today's live session might be compromised. So let me just begin with the session. Okay, Shaima says good evening, sir. Jessie Rachel says good evening, sir. Good evening to everybody. And once again, welcome to Medcity's live session today and tonight. And in today's session, as I promised last time, I'll be talking about the session that is part A. And I mentioned at the beginning, part A is comparatively pretty easy. So before, right, okay, Anand says that we love you, sir. Okay, thanks so much. All right, of course, we do love, and that's the reason we come up with this kind of sessions, probably in a transformation of our love, probably in the form of helping you out in your learning program. So great. So let me just take you to first and foremost reading part A and give you a little clarity. And I want you to look at the screen and to understand what is exactly reading part A. Okay, right. Krishna Singh Rajput says hi, sir. Hi. Okay, fine. Let me just have a quick recapturing of what is exactly part A. As most of them do know that there are 4 texts, A, B, C and D, which is always related to the same topic, and that's called text A, text B, text C and text D. And then you have types of questions in the form of matching questions, short answer questions and sentence completion questions. And this is how the part A is moduled. Right, there are 4 texts which would be always related to the same topic, and the type of questions, matching questions, short answer questions, sentence completion questions. All right, and of course the complete questions or the total number of questions are always 20 questions, which you are expected to answer in 15 minutes of time, and that's the most challenging. Most often students do ask this question: how effectively and how possibly someone can manage the time. And you don't need to really worry about managing the time at this point, because we are learning a particular method or a strategy with which we can really handle the part A. So I would rather suggest anyone who would ask me, please learn a procedure or a method and then try to experiment and explore that particular strategy. There are various strategies that are used by different trainers, and I would also suggest don't stick on to one particular strategy. You may apply different strategies when it comes in terms of handling and doing part A. please. And tonight I'm going to talk about, rather we would discuss a particular strategy, and you try out with this method, and if you feel this is feasible and it's okay with you, please follow it. Or you find a strategy elsewhere which you think that is convenient, please use it. I don't really compel a person to stick to one particular strategy, because there are various methods with which one can do part A. So let me just take you to the strategy which, okay, Nitya Suni Singh says, good evening sir. Jibin Joseph saying that I'm watching. So thank you once again for joining, and let me just take you to part A and show you how the question exactly look like. Now let me just take you, I want you to look at this one. As I said, text A, as you can see here, it is actually managing or management of burns, you can see that, and there is text A and then followed by text B related to the same topic, that is management of burn, and again text C, right, again related to the same burns, and finally it's related to the text D is also related to using analgesic when it comes in terms of managing burn. So this is how the text or the particular module is formulated. And then obvious you will have type of questions. As I said, the first one, matching questions. You're supposed to identify the questions which are 1 to 5. Where do they appear in either text A or B or C or D? And then you get actually short answer questions. I'm sorry, here it is sentence completion questions. So look at, you are supposed to complete the sentence with a word or a phrase, and then you have short answer questions would be either a word or a phrase. So this is how part A is formulated. Now let me just take you to the strategy. Now let me ask a question to few of you. Please let me know that what strategy that some of you apply. Of course, a lot of people are watching me, and I am sure that this is not the first time that people do part A. Probably there are like people who have been doing different strategies. So my simple question, if anyone could type and help me with what strategy or what method that you often apply. Probably I'm just waiting to see your answers, because as I said, there are different methods and strategies. And if someone could help me and saying that this is the method that you apply, please, I'm watching it out. Right. Do you have any specific strategy that you apply? All right. Okay, fine. If not, okay, yes. Naina Thara says, good evening, sir. I asked a question that, do some of you follow a specific method or a strategy in order to handle or solve part A of reading OET? Right. Okay. Fine. No issues. I hope that people are still typing it. Maybe I'm getting it a little later. Right. Let me just take you to a particular method here, and I want to just help you with tonight. And the strategy looks like this way. I just want you to look at the first thing. Read matching questions and pick the keywords in 1 minute of time. So maybe I'm just going, yes, people are, okay, they are suggesting. Susan says that skim the passage and scanning it. Okay, skimming and scanning, of course, that is true. Most of the people do use this particular strategy. So let's understand what is skimming and what is scanning in bit detail. All right. Okay. Very good evening, sir. Licho Anthony says, Licho, good evening. Yes. Shan says that yes, skimming and scanning could be the ideal method that a person can follow. Good. Hi, good evening, sir. Jinu. Okay. Good evening. Right. Okay. So some of the people have suggested me that they go with the skimming and scanning process, and of course that is always acceptable. And let me just help you with a little different way. So here, the first thing, read matching questions as I showed you for the first, and then pick the keywords in 1 minute of time. Don't spend much time, because people do suggest that you read the text A, B, C, D first. That's what most often people do it. But I'm just going a little reverse in order. I'm just asking you to read that 1 to 7 or 6 or 5 questions. They are called skimming and scanning technique, sir, but still I am finding it difficult to get the proper answer. Ashna Joseph says that. Of course, I do understand. Just randomly skimming and scanning will not make things to happen the way. You should also understand the question and the answer context. Okay, let's do it now. So thank you for at least answering my question. Now let's go with read matching questions and pick the keywords in 1 minute, and then read the text A, B, C, D randomly. That's called skimming through. You try to skim through text A, B, C, D. The advantage of looking at 1 to 7 or 1 to 6 or 1 to 5 questions, which is known as matching. Of course, at any cost, you're going to read text A. Either you randomly read, that's called skim through it. While you're skimming through it, you may get a chance to answer at least 1, 2, 3, 4 questions out of that matching questions, because you are reading actually text A, B, C, D. So you all often do that, because often students would say this one, sir, what we do it actually we read text A, B, C, D and get an overall idea of it. Fine. What are you doing? What's the problem in doing that 1 to 6 or 1 to 7 or 1 to 5 questions? So that's the reason I said read the matching question first, then you go to the text, read randomly. I would say rather just skim through it. While you're skimming through, please understand the first thing, identify the headings, side headings and bullet points. That's a key. So there would be a heading and there would be side heading and then there would be bullet points. Bullet points is nothing but the dot, the black one, dot one. So just look at that bullet points. Probably when you look at those bullet points, just think of actually the verb form and noun forms. Okay, then you can answer matching questions while you're skimming through. So please read out headings, side headings, bullet points and make an overall summary of that text A, B, C, D. And while you're doing, you could also just link with, okay, I have seen this keyword somewhere else in matching questions. So this is the method tonight I'm going to apply, and probably I want all of you to join with me and just try to do that. So let's take the reading file as I said. Let me just take you to question number 1 to 5, just 1 minute. I say that if you really want to manage the time, try to do it in 1 minute of time. That here are 5 questions as matching. Don't take much time, just randomly go through the 1 to 5 questions. While you're going through, just try to pick the keywords. The keywords are always either in the form of verb or in the form of noun or in the form of number. Now let's look at that. The first question here, age related. Okay, so they're talking about age related consideration for initial treatment. Of course, you know that this file is all about managing burns. Now first thing, age related initial treatment. Just keep in mind this one. Then risk involved in certain treatments. Risk involved in certain treatments. When to start thinking about specialist treatment options. So think of this one, age related consideration initial treatment. Okay, some sort of risk issues, problems in certain treatments. Next one, when to start thinking about specialist treatment options. And again, treatment informed by patient, okay, by patient self-assessment. Now look at here, this is also to be very, very keenly noted. Treatment informed by patient self-assessment, by patient self-assessment. Think of actually self-assessment. And the next one is how to categorize. So when you think of the word categorize, the severity of burn, so categorization, classifying, segregating, putting it up. Now my dears, this must be done in 1 minute of time. Even if you take 1 minute and half, nothing gonna be, like affect you as such. So please read through 1 to 5, 1 to 6, at times it's 1 to 7. Now you know that I'm going to read text A, B, C, D. While you're just going through text A, B, C, D, what's the point in actually, if you get actually, okay, age related, initial treatment, okay, initial at the beginning. So if it is related to age, okay, I'm just going through text A, B, somewhere else I would say that, okay, treatment and some risks. So then again, I'm just going through somewhere else, it's actually given that you need to start actually a specialist treatment options. And again, okay, you just go through it somewhere else with that patient self-assessment, okay, somewhere around. and how to categorize. So this is what the 1 minute that you have to do. I hope you're all following me, and please watch it out. This is one kind of a method that you can apply. Now I want you to jump into step 2. What is step 2? I want you to look at again. The step 2 says that read text A, B, C, D randomly, which means look up the headings, look up the side headings, and then the bullet points. While you're going through the bullet points, make sure that you identify the nouns, verbs, things, because that would definitely help you to make an overall summary of it. And while you're doing so, you may answer, we have already looked up 5 things. Age-related initial treatment, I don't know whether it is there or not. So this is what step 2. Now let me just take you to the step 2. All right. So please do along with me. I'm going to read randomly or just skim through. The first one, just the heading is actually burn depth. And again, burns are classified. So you see that somewhere else we have seen in the question categorized. Look at here, burn injuries are classified according to how much tissue damage is present. So my dears, let me ask a question. If you were to just read text A, B, C, D, most often we apply this method, having missed that 1 to 5 questions. Now just look at that. There is a word here, burn injuries are classified. Have you seen it somewhere as the word classified? Yes, indeed. We have seen in this 5 questions of actually classifying or categorizing. Now look at actually burn injuries classified, how much tissue damage is present. Just randomly go through classified. So probably, could someone answer me? Any of this one? Could anyone answer that? Where have you seen that, or which question matches to this one? Of course. Now look at here, that takes you to the 5th one. How to categorize the severity of burn. So it is classified according to the damage happened. So now please understand, at any cost you're going to read text A, B, C, D for understanding it or skimming through it. By doing so, what's the problem that if you could do and manage one answer, which is damn sure. So here you could say how to categorize the severity of burn, and that is there in text A. So probably you answer 5th question as A. Now let's go and do it. And just, you just randomly do it. That's it. Okay. What are actually the, the classification? First one is superficial partial thickness, or it's also known as first and second burn. Just randomly full thickness burns. Okay, just understand this is also known as 3rd degree. Okay, so you have the bullet points now. Don't read completely, just look at the bullet points. Okay, burn extends. Okay, the keyword extends subcutaneous tissue. That's it. Okay, underlying tissues may appear pale or blackened. That's it. Remaining skin may be dry, white, and okay, dry and white. Just think of it. Healing associated with considerable contraction and scarring. Now this is what just skim through. Don't read completely. Again, let's do that. Mixed depth burns. So there are 3 classifications: superficial, full thickness burn, and mixed depth burns. Now just go through it randomly. Alright, the clinician should image by the appearance and okay. The clinician should estimate the average depth by the appearance and presence of sensation. That's it. Right. Resuscitation should be based on the total 2nd and 3rd degree of a local treatment should be based on the burn thickness and okay, burn thickness. Okay, done. This is called just skimming through. Now you get an idea about part A. Part A is talking about the classifications of burn based upon the tissue damage. There are 3 different classifications. So your summary would be that the classification of burns based upon the how much damage is done to the tissue. That's it. All right, let's move on. Next one, fluid resuscitation of the burn. Just this is the heading that just look at the numbers. All right, if the burn is just 50, just look at those numbers, which are very, very important in adults. Okay, it's talking about adults. And when I say adults, there's something else we have seen in the questions. Can anyone say that can you pick up this adults and in children? Can you just match any of the questions which we have seen that 1 to 5 would really match to this particular point? Can anyone answer me, or can anyone help me with that? I hope you understand my question. So when I read the first line of text B, so I got it something actually that fluid resuscitation. If the burn area is over 15% of the total body surface in adults or in 10% in children, intravenous fluid should be started as soon as possible on scene. Right, they're talking about as soon as possible. Right, for adults and children. Can you just relate this to one of the questions which we have seen in matching? Can anyone just let me say that yes? Roshni Vinod says yes. Uma says that sir, we can easily relate to question number 1. Sabida Sanish says yes, 1. Age related initial treatment. Jenny says that. Now look at my dears, I have a question now. We tend to do that text A, B, C, D. Nothing wrong. I'm not against that method. But having said, you at any cost go through this text A, B, C, D, then why don't you answer this possible questions, which hardly takes 1 minute or 1.5 minutes to read it out. Now, are you not so sure about the answer which have seen it now? Of course, it speaks about, as all of you said, it's true because the first question says, or the matching information or matching to the text says the first question that age related. Now look at here, age related consideration for initial treatment. So what does exactly paraphrase this initial treatment in the text? As soon as possible. So immediately, age related, adult and children. 15% total body burn than it is in the case of adults, and if it is 10 in the case of children. So this is how you are aiming at answering other questions, but there is nothing else that you would lose it. Rather, you will get the possible answer. So please do that and try it out if at all you feel convenient. Now let me just go with. All right. So again, and all the transfers should be delayed on more into cannulation attempts. Again, it says that all right, transfers should be delayed by not be delayed by more than 2 cannulation attempts. They're talking about 2 attempts for physiological reasons. There's the threshold is closer to 10 in elderly, blah blah. You need not worry about much. All right, suggested regime for fluid, just underline, this is actually the heading. Again, adults, just look at, I don't think that you need to really read completely. All right, adults may be resuscitation fluid alone first 24 hours. Again, children, just look at resuscitation fluid as above plus maintenance of this. That's it. Don't read much. Maybe if you want, you can just have these numbers, like maybe look at these numbers, which is also equally important at times. Now tell me what the summary of text B. So could someone tell me what is the summary of text B, if you can? So would someone help me saying that what exactly text B, please help me with. All right, so it is nothing but actually the initial treatment of in case of burn, and they say that fluid resuscitation, it is based upon age, and this is adults and children. So that could be the summary of it, which should definitely help you to do rest of the questions. Now let me just take you to text A. Management for burns. So what to and how to manage it. So this is the one which confuses most of the time the students. Of course, I would rather say they are all bullet points. 1 to 9, they are bullet points. You may not get time to read all those things, but as I mentioned at the beginning, just try to pick the keywords. Keywords are always what to do. All right, what to do, and there is a noun associated with that. Now look at the first thing, assess the patient status. So think as management for burns or as a treatment, you can do it actually how to manage it. First thing, assess the patient status. Next one, assess the burn depth and the extent, how much it is that. Next is cooling, right? So it's a big one. They say that cooling, all right? So they're talking about so many things, 12 and to look a limited blah 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 blah, cool water, again cool saline soaked soft gaze or large sheet in the case of blah. Cool the wound, not the patient. Again, they are saying the same thing. Cool and cool, cooling. Cool the wound, not the patient, right? Not the patient, taking care not to cause hypothermia. Yes, you understand this particular terminology, all right? Because of excessive cooling, a person might experience a kind of chill and shivering, and that's what the medical terminology, I think most of you people understands because you belong to that medical field. All right, so understand that the management is assess patient status, assess the burn and depth, cool it, but make sure that it should not be excessive. Pain control, again says that actually, think of actually pain control, just look at, check the immunization status. It is talking about checking immunization status. If possible, begin fluid resuscitation, just actually debridement of blisters or breaking of blisters. So it's talking about breaking the blisters, but there are two things here. Some suggest leaving it intact. Some people suggest that leaving intact because the blisters act as a barrier to infection. So some of the people suggest that don't break it, leave it because it protects from infection. Others says that no, a necrotic skin should be removed. All right, that's a contrasting thing. Application of antibiotics in the form of ointment and then apply suitable dressing. Now please do understand, you understood actually what to be done or what are things that you have to do in order to manage the burns. Now tell me what is the heading for or what is summary. As simple as that, various ways of managing burns. That's it. Now the first thing you gave actually summary, the second text you gave a summary, and the third text you gave a summary. Now tell me actually, is there something that is related can actually have from 1 to 5? If you just think of actually 1 to 5, is there something else that you can relate? Now think of actually, right, you already answered how to categorize the severity of the burn. You already answered it. Now let's look at actually, we read actually C. Now the risk involved in certain treatment can be from part C because they talked about different methods. They said actually cooling, but they contradicted by saying that excessive cooling can lead to maybe shivering, hypothermia, the word they used it. So the section C also speak about actually treatments, but it can sometimes put a risk. Again, they talked about breaking of the skins, and they said saying that please don't break it because it can prevent the infection. So it is exactly talking about the risk involved in certain treatments. So they talked about the management for skin, but there are certain limitations or risk associated with. So possibly you answered here. So while reading text A, B, C, D, we could answer first one as actually the second one we answered, and the fifth one we answered. Now we have 3 and 4. But let me ask a question. Are we really targeting that 1 to 5 questions? Literally not. Please understand, we are not targeting that 1 to 5 questions or 1 to 6 questions. We are just trying to understand text A, B, C, D in detail. By doing so, you could also answer, if you take 1 minute to understand that 1 to 5 or 1 to 6 or 1 to 7 questions, which are damn sure, at any cost, at the end of the session, towards the last, you would again try to do actually 1 to 5, which is again a time consuming. Then why don't, if you could read it at the very beginning, and if you can pick it up certain answers, even then while you're going through it, you are not able to answer, let's say 1 or 2 questions from 1 to 6 or 7, just leave it, because at the end of the day you can come and answer it. So this is the advantage of reading that 1 to 5 or 1 to 6 or 1 to 7, that's called matching questions. Let me just take you to text D now. Let's understand what is text D. Right, adult analgesic guidelines. Okay, they're talking about using the painkillers, and of course, just go through it. All right, the following table, oral analgesic guidelines for management of injuries aimed at, analgesic should be reviewed after, it should be reviewed after 72 hours. Maybe numbers are very, very important. Patient management should be guided by individual case and clinical. Yes, patient management should be guided by individual case. Somewhere else we read the same thing actually. The treatments are actually by the recommendations of or assessment of individuals. I think if we can just go down, possibly we can answer that as well. Can anyone pick the answer from here? Because we have actually two answer options from 1 to 5. Can anyone just give me the answers from this one, if possibly? Which paragraph would it? Of course, by default, you know that it's going to be obviously D, because we read actually text A, text B, text C. We were not able to identify, right, which one? 3 and 4th one. And this is by default, it's going to be there in text D. But let's confirm it actually. Now let's see that actually treatment informed by patient self-assessment is exactly what we have seen the first or the second line of text D. Look at patient self-assessment, treatment informed by. So how did they paraphrase that word? If you look at here, you could easily say that patient management should be guided by individuals, right? So it's exactly giving you the paraphrasing. Now there's one more answer option left in 1 to 5, and that is right, when to start thinking about specialist treatment options. Let's see that whether this information can be found in the same text. So by this time we answered almost 4 questions. Let's go through it. Now, pain score elicited or extracted from patient from or on a scale of 1 to 10. Now look at the first thing. Please, this kind of columns are very, very important. The side headings would give you so mild pain, which is actually 1 to 3, and the management is a recommended painkiller, paracetamol, and if needed naproxen. So just underline these names. That's it. Okay, moderate pain 4 to 6 range, and of course recommended analgesia in addition to the column 1. This one again. Tramadol 5, okay, 50. So just think of the names, don't worry about much. If above all unsuccessful, just go with Endon, okay, fine, and review in 72 hours. Just do it. Again, severe pain, just score between 7 to 10, just same thing. And strong opiates, Endon, then go ahead and just maybe review again 72 hours. If the pain cannot be controlled, yeah, they're saying that if it cannot be controlled, consider admission to burns unit. Yes, and this is what you need to think of. Actually, there is one more question left out, that is saying that when to think of a specialist treatment, and the treatment is when. See, consider admission to burns unit if pain cannot be controlled through oral medication. So now please do understand we were able to answer all that 5 questions, and reminding you that we are not targeting that 5 questions. Please don't misunderstand here. I am not literally targeting that 5 questions, but my target or my aim is to understand what is text A, B, C, D. In doing so, I would also have a great scope to answer that matching questions, because if you really logically think, come on, these matching questions are to be, or they should match to those texts. So when you go through those texts, it is pretty easy to answer that 1 to 5 questions. So this is one method where you can really understand and get the answers. Probably, I just would love to, and if at all you want to have practically this method, of course we have a great help that is called Medcity's OET app, and I really want all of you to just take a time to go and watch it out. Medcity's OET app, which is a great help. Probably you will have a great amount of explanation, and you have a great amount of practical way of doing your reading, your writing, your speaking, your listening. And the beauty about this app is actually it is always being updated. And as a result, what happened, you will see that things are coming up and getting into this app which are new. So probably you will not have a feeling of, oh, I'm doing something very old version. No, it's always being updated. So please watch out and take the pain to go and see that what's happening, the Medcity's OET app. Please don't misunderstand, I'm just not promoting it, but that's gonna be a great help, because always we may not get a chance to sit and watch things according to your preference. But you have this app in your hands, you travel it, you're just about to hit the bed, you want to have something else, okay, just go there and click it out and see that exactly how beautifully it is being narrated. And probably that's a great help. So please watch it out for that, and it is just $4.99. Just buy and keep it with you, because it's gonna be great help. So please, that's all about the app from Medcity, which you can easily download, right? So let me just take you to the rest of the questions, right? I said at the beginning that we just read randomly, or we just go through text A, B, C, D. Now you got an idea about what exactly text A, what exactly text B, what exactly text C and D. Now that makes a little more easy to do rest of the questions. And let me just take you to again the text which we have seen, just to have a random look. Right, look at text A. It is classifications of, like burns based upon damage done to the tissue, superficial, full thickening and mixed depth. And of course it's also named as actually first and second degree and third degree. Just have a look, right? Let's go to the next one. Right, text B speaks about actually the initial treatment, that is fluid resuscitation, and it's based upon age. And of course you understood that the age factor, one is adult and one is children. And the text C talked about the management for burns, and we have certain bullet points, and we have gone through the bullet points. And of course Alina says the app is really helpful for OET students, especially for beginners. Thank you, Medcity. Okay, that's a great realization, and it's a great word from Alina. Probably people might have gone through, that's the reason they come up with this kind of suggestions. Okay, great thing. And now we understood. Now let's say, I'm sorry, I think I missed a little part of text D as well. Okay, I'm sorry, there's a bit left here. So look here, pediatric analgesia guidelines. So we talked about adults, and now it's pediatric. Just look at paracetamol and naproxen, ibuprofen, which is done orally, and this is also orally or PR or page. Okay, just say that's not much about it. Now you understood the like the side headings and the summary of it, and I'm sure that if someone asks you anything about classification, you know that your attention would definitely goes to the text A. If someone talks about fluid resuscitation or the initial treatment, I'm sure that it triggers in your mind, come on, oh, it's not an A, oh, I have seen it as an B, all right, oh, good, fantastic. If I see that something that is treatment and management of burns, of course I know that it's there in text C. And probably when I talk about using painkillers based upon the age, like adults or actually pediatric, probably you may have a question to have a clarification here. So let me just clarify, because age factors here, there's a question in 1 to 5. You might say that what is called actually age related consideration for initial treatments of burns and injuries. So you might ask, why not text D? But the text D is absolutely later, almost like 72 hours. But the other one, text B, speaks about actually as soon as possible, and that's the reason that the A takes the answer of the other one, not D. Please, I'm just, maybe this doubt can be at the back of your mind, flashing it out. Matthews, tell me why not the question number 1 can't be text D. So it's actually later treatment, and that's exactly about managing the pain. But as soon as possible, what you need to do that actually fluid resuscitation, and that's the reason the first one. I hope if at all you have this doubt at the back of your mind, please clarify it. Now let me just take you to all, and your time starts now to have a great fun. Now do the rest of the questions based upon the summaries that you have made. Now let me just talk about classification. Let me ask a question. Can anyone answer me my question? Where do you figure out, or where do you really go and identify this question would be? Your simple common sense, classification of burn injuries. So you just understand the keyword is what? Classification of burn injuries. Now where do you go? Which paragraph? Would you go to text A? Would you go to text B? Would you go to text C or D? Could someone answer my question, please? Which text would you go? Would you go to text A? Would you go to text B or C or D? Can anyone answer me? I'm waiting to see that your answers. Okay. So here it is. Classification of burn injuries depends on the amount of something, right? Forget about rest of the things. But my question, the moment that you see classification, it should take you to text what? I'm sure that we already made a summary that yes, text A speaks about classification of burns based upon something. Now you know that yes, exactly. Sabita says it's A. Yes. Uma says it's A. Midhu says it's A. Anita says it's A. Exactly. This is what I said. Come on, let me ask a question. If at all you missed that 1 to 5 question, but imagine, my dears, you missed a great chance of answering 5 questions already. So at any cost, you are going to answer 6 to rest of the question. You read actually text A, B, C, D. In doing so, if you answer 1 to 5, what's wrong in that? So right? Okay. Most of the people, Jibin says it's A. Mary Binoy says it's A. Harida Vinit says it's A. Good. Fantastic. Now let's see that classification of burn injuries depends upon the amount of dash cost. So we'll directly go there. Let's see that. Classification of what? Let's read out text A. Right. Burn injuries are classified on the basis of how much tissue damage is present. Alright, the answer is actually burn injuries are classified on the basis of how much tissue damage. So you get your answers easily, and you will not go to text B or you will not go to text C. You will not neither go to text D. Why? You're damn sure and pretty sure about, come on, I know the classification is being mentioned in text A, and if anything related to that classifications, my target is text A. There's no doubt at all. Now you just read it. Maybe you need a little time. Read it actually. So burn injuries are classified according to the tissue damage, right? All right. I want all of you to just look at and see that how the answer is being done. So let me just take it to the next question if you don't mind. All right, I want you to answer it, okay? Right, let me just take you there. Patients recovering from 3rd degree burns. Now, the second question that I would like to ask you, where do you go to find this information or answer this question? Patients recovering from 3rd degree burns are likely to experience a great deal of shrinkage, and the keywords are this. Please understand 3rd degree burns. Alright, patients recovering from 3rd degree burns are likely to experience a great deal of shrinkage. So the keyword is shrinkage. So I just want you to answer me. I don't want the answer tonight. I want you to answer me. Where do you really figure out, or where do you really think that this answer might be? Right, please answer me if you could. All right, okay. Sasa says that it's A. Okay, tissue damage. Okay, Uma says it's again A. So what made you think actually it is A? Because it's saying that the classification, right, 1, 2, 3 types of classifications. Let's go that actually 3rd degree burns. Now let's look at the question once again. Patients recovering from 3rd degree burns are likely to experience great deal of shrinkage, and I want all of you to answer now. I'll take it to text A. As you said, why should I go to text A? Because it's saying that classification of burns. So it is 3rd degree burn. We have seen it actually in text A. Now let me just take you. I want all of you to answer me now. Right, you said correct. Right, look at. So right, superficial, okay, partial thickness burn, it is actually 1st and 2nd degree, and this is 3rd degree burn. So look at your full thickness burn, also known as 3rd degree burn. Now I want you to show you a question once again, please. The question is this, very simple. Look at this question. All right. patients recovering from third degree burns are likely to experience, they might go through great deal of shrinking and dash of their skin. Let me take you to that, and I want all of you to answer. I'm waiting to see your answer now. Please look at, okay, read out. All right, skin. Look at here. Let's say recovering from. So what's the word recovering here? Look at, no, that's not talking about recovering, appears. Okay, remaining skin, recovering. Yes, healing, recovering. See, paraphrasing. Questions that patients who are recovering from, healing from, with associate with considerable contraction. What do you mean with contracting? It's nothing but shrinking. And the answer, I'm sure that, right, Jintu George is answering me. I want all of you to answer this question. Shrinking of the skin, and there is something else as well. Exactly. Roshni Vinod says it's scarring. Exactly. Now tell me now, my dears, will you not really be confident about answering this? Because you're pretty comfortable about, okay, third degree is nothing but actually, oh right, the classification of burning. All right, third degree. And again, keyword, recovering from, healing from, considerable contraction, shrinking, and then scarring. So the answer is scarring. There's no doubt at all. So please be confident of doing this effectively. Let's go to the next question now, possibly if you can. Right, let me just take you to the next question. And I know that the scrolling becomes a little, a little issue for you and me as well. Now let me just take you to the next question. When evaluating mixed burns, okay, please understand the question is when evaluating mixed, evaluating mixed depth burns, you should take into account how the burn looks, okay, and whether there is a dash in the affected areas. I want again to answer all of you to look at and say that, where do you figure out this when evaluating mixed depth burns? Which paragraph will you target this question? I want all of you to answer this question, please. Which paragraph, either text A, text B, or text C, or text D? Where do you really go for searching this answer option? Please, the question is this: when evaluating mixed depth burns, you should take into consideration how the burn looks. Looks means how it seems to be, how it appears to be, how it looks like, and how the burn looks, and whether there is a dash in the affected area. Now tell me, where do you really go for this answer option, if at all you really want to? See, we already understood text A, B, C, D. Now where do you go? Because it's talking about mixed depth burns. And I'm sure that, right, Reba says, thank you, sir. All right, Reba, not yet done. There's a bit more to go, right? Thank you so much at least joining me. All right. So please, I want you to answer, where do you go? Which paragraph will you go and figure it out, this answer? Right, mixed depth burns. Of course, you know that that is there in classifications again. Mixed depth burns. So let's go and answer. Okay, there are people who are answering me now. Let me just take you. When evaluating mixed depth burns, you should take into consideration how the burn looks and whether there is a dash in the affected area. Yes, Jindu George says that it's part A. Jenny says it's part A. Thank you so much. Probably you're really, concentrating on what all things we have already summarized. So you know that the summary, I know that actually. All right, classification. Let me just take you there once again. When you evaluate mixed depth burns, you should take into consideration how the burn looks like and if there are certain things in affected areas. Now let's go and see that. I want you to get the answer now. Right, it's in text A again. Right, mixed burns. Where is mixed burns? Here it is. And I want you to actually answer it, please. I'm waiting to see your answer. Please, when you evaluate the depth of mixed burns, think that whether the skin looks like something, or there is something there in the affected area? Please, I'm waiting to see your answers. Please. All right, you said actually it is in the text, of course, because we know that it's a classification. Now think of actually when you're evaluating, right? The question is when you're evaluating the depth of mixed burns, you should consider that how the skin looks like, and then there is something else in the affected area. I want, yes, Jindu George gives me an answer saying that sensation. Roshni Vinod says that it is sensation. Okay, thank you. Great job. Your reading becomes more effective. Savida Sanish says that it's sensation. Fantastic. Now, I'm pretty happy about the answers. But now I also want, maybe when I sit and do this explanation, it's pretty easy. But what makes you to think actually, you know that the answer is in here, mixed depth burns. It looks. So where is looks? Here it is, appearance, look like. This is what I want. People, those who are not able to do it at a stretch now, probably you need to go back and think about, oh God, is there anything that I can relate to that question? Yes, obviously there is actually. The skin looks, appear to be, or the appearance, oh God. So burns are frequently, burns are frequently of mixed depth, right? The clinician should estimate. Alright, evaluating, estimating. The clinician should estimate the average depth by the appearance and the presence of sensation. So while you're estimating, the clinician should give great consideration how it looks like and whether there is sensation in the area. Now, this is what I said. Nothing is actually simply given. It is a great amount of your understanding of those vocabularies which are paraphrased. What is there in the question? The skin looks like, or it looks like that. And then again saying there is something else in the affected area. What is there? There is sensation. These are the two things that the clinician should consider when estimating or evaluating the depth of the skin. Right. Hope you people are able to answer the sensation. Thank you. Yes, Ashna Joseph says, paraphrasing. Sam says, how are you doing? Sam, I'm really good. Thank you so much. Hope the same with you. And probably hope to see you many more sessions, which we are going to hoist soon. Right. Thank you, Sam. I'm sorry. Let me just take you to the next question now. All right. The question which we answered it so far is what? All right. I want all of you to answer this question. All right. Right. You should cool burn injuries. And I'm sure, tell me, where are you going to search for this? Would you really search in text A? Would you really search in text B? Would you search in text C or D? Now let me know that, because the word is cool, right? You should cool burn injuries by taking off dash, such as the jewelry that the patient is wearing. So you should cool burn injuries by taking off any dash or jewelry. So they're asking you to take off the jewelry, the like things that he or she is wearing. All right, the ornaments. Okay, cooling. I'm sure that yes, people started to say that. All right. It is in text C. That is the answer by Jintu. Uma says C. Pavan says it's C. Sonia Sibi says C. Okay. Sarva Swati. Okay, says it's C. Jintu says okay. Hot clothing. All right. She already answered me. Or Sabida says okay. Management text C. Removing clothing. Yes, please. Pavan Kumar says hot clothing. Good, Pavan. Fantastic. Good. Soumya says it's C. Harida says okay. All right, ninth question, text C. Good, fantastic. Now look at here. You should cool. This is what I said. Reading that bullet points is the most important thing. You didn't read completely, but you know that the answer must be in C, because I went through actually management for burns. They said, all right, assess the status, assess this. Okay, cool it out. Now it's easy. Now you should cool burn injuries by taking off, by removing the jewelry and something else. And I'm sure that you might have answered. Some of you have already answered me, but let me just take you for others to answer. All right, text. Oh, I'm sorry. I'm just moving with text. Okay, let me just scroll it down. Here it is. Right, cooling. Now think of actually remove jewelry, take out, or hot clothing. So the answer is straightforward, pretty straightforward. So you answered it actually removing is nothing but taking off. All right, and what? The jewelry as well as hot clothing. So this is how you should answer it. And let me just take you to the next question. So it is interesting now because everyone is trying to give the answer. That is fantastic thing. We answered the 9th question. Again, when cooling the wound, I want you to look at the 10th question. When cooling the wound, make sure that they don't put the patient at risk of something. Oh, good. You should answer this because we already read actually something there. All right. Okay, fine. When cooling the wound, make sure that you don't put the patient at risk of something. Right. I'm sure that again, this answer option is going to be there in part C because we discussed cooling. Again, I know that this answer option is going to be there in part C. There is no doubt. Let me just look for your answers now. I'll show you the text. So when cooling the wound, ensure that you don't put the patient at risk of something. All right, what is the risk that they discussed in that particular paragraph or the text? Let me just take you there. Right, cooling. Right, I want all of you to answer it. Please look at it. Is here the 3rd bullet point, and please do read and answer me. When you're cooling, make sure that you don't put the patient at the risk of dash. Right. Yes. Soumya answered it. Hypothermia. All right. Hypothermia. Right. Pavan Kumar answered it. Good. Fantastic. Great job. And I think you should have answered even without looking at, because we were going through this bullet points. And that's what I said. I really don't claim that this is going to be the easiest method, but rather I believe that when you start doing it, maybe this kind of strategies would definitely help you. So let me just try to give you a little more, a detailed thing about what we have done. So as I said, maybe, of course, it's almost going to be 1 hour. Therefore, I really wanted to do the rest of the questions. And of course, this reading material is from official website. Probably you can download it and start doing it. So let me just take you and what I have discussed so far. But I really want to recap what I said. So I said actually the simple method, of course, as everyone does it, you read text A, B, C, D randomly. You try to locate the keywords and you try to scan it. But you need to keep in mind, what am I scanning for? Right. So you're scanning for means what you're specifically looking for some words. And those words can be from that 1 to 5 or 1 to 6 or 1 to 7 questions. What's wrong in that? Like when you say people say scanning, what does it really mean? You're looking into depth to get something. And you should have in mind, what should I look forward? Oh, I should look forward those keywords which are there. Like question number 1, 2, 3, 4. All right, age-related constipation, initial treatment. Okay, I can just scan out for this. So you're doing actually a focused reading. Please don't just simply believe that scanning is just going through the words in the text itself. No, you look for something that you're suspicious about, and that's what the doctor does it. And if a doctor wants it to, he or she does the same thing. Oh, I'm suspicious about something there. Let me just look for that. So this suspicion is nothing but those keywords which are there in question number 1, 2, 3, 4, 5, 6. And probably we need to understand that word scanning in detail now. All right. So the rest of the thing is actually called just skimming. And if you're reading text A, B, C, D, it's called skimming. You're not scanning it out. What are you scanning for? But when you take these keywords, you're really scanning and you're skimming. And this is called skimming and scanning, not the other way around. So hope you really understand what I said. And please, I couldn't do the entire questions. Of course, leaving it out for you, and use this method. Probably this would help it. As I mentioned at the beginning, This is not a hardcore strategy that everyone should apply. If you feel it, oh God, this is gonna be helpful, and I feel it's convenient to do it, it's pretty easy, then you take up. And that takes me to the end of the session today. Once again, thank you so much, all the people who have joined me from different parts and still encouraging us to do this kind of sessions. And thank you. Good night.